Mr. Jagdish Thakurse has a reason to smile.
My grandfather's name was Madhavji Damodar Thakurse, and he along with 4 other partners founded this hospital. In those days, healthcare was non-existent in a proper way, and in those days it was very much community based. So it was basically meant for the Bhatia community, and that is why it is called Bhatia. The objective then was very clear: to have a good, affordable healthcare facility, mostly for the middle class population of the city. Now I carry this mantle. It is our mission to ensure that Bhatia Hospital delivers good healthcare. We are a public trust hospital and intend to remain so in its true spirit, not just in legal compliance, but in practical implementation of its founding principle of public service.
Today, the dream stands realized in the form of a 6-storied, 200-bedded, multidisciplined hospital on the same founding stone. It houses facilities for casualty, operation theatres, international standard ICUs, physiotherapy department, audiometry and speech therapy department, burns unit and pediatric care. Filling details to the vision is the CEO of Bhatia Hospital, Mr. Shrikant Soman. The CEO has a reason to smile. Let's know from him.
Our satisfied patients are our brand ambassadors. This is our philosophy. A smile on the face of the patients after they get cured gives us the feeling of worth. This is the core of all our operations. In a nutshell, this is what we do. This is our passion, striving for excellence in healthcare with full heart, with dedication, not just by one person, but every person in the team, whatever his level, whether he is sweeper, he is liftman, he is nurse, he is medical director, whoever it is, we are all driven by that single pointed passion. This is what is healthcare which we are in. This is the way we do our own healthcare things, and we are very happy about it, and I really enjoy every day which we bring in here, which brings in new experiences and also brings us forward in life.
With credibility and faith that people place on us comes responsibilities and challenges to stand up to in face of complexities.
Our burns unit was started here by Dr. Ravi Thatti and now taken over by Dr. Ranade. It has got the unique features that it has got its own ICU, it has got its own operation theatre, it has got its own ward.
Dr. Ranade from Bhatia Hospital tells us why the burns unit at Bhatia Hospital is the best in the city.
We function as a big team of burns in this hospital, where we have got an intensivist, a plastic surgeon, a physiotherapist, a dietitian, occupational therapist, and all in all give a complete comprehensive care to the burns patient, which is very, very rare in all over the city of Mumbai. There are many such stories. There was a patient with electrical burns who had to had an amputation of his entire right upper limb because of the electrical burns. He had a very bad neck burns, and we were worried about his life. He had lost his voice then. He was on ventilatory support for 3 weeks. But if you see him now, you will not be able to recognize he was the same patient. With one hand amputated, we could give him a very beautiful modern prosthesis which could do all the work of his hand, which he would not have been otherwise able to do at all.
The patient not only healed from the scars, the memories have left no mark on him.
Now in physiotherapy over here, we get all kind of variety of patients. Majority of them are orthopedic, but we also get a lot of pulmonary patients. In fact, we see patients coming in a wheelchair and they go back walking, and that's such a wonderful feeling. We always see the patient individually. The treatment programs are tailor-made, they're customized.
I had a frozen shoulder for about 15 months. I had a procedure done in England with some temporary relief, and later on it continued to be very serious pain. But she's been very good. I have a lot of movements which I didn't have before, and the pain is much less.
Cleanliness, tidiness, management, timing, everything was top as far as I can say. So there was no hesitation in coming on a regular basis and getting the fruitful treatment of the day.
This hospital has been more popular, especially in the departments of orthopedics, in the departments of bones, and in the department of pediatrics. We have the achievements in all these branches to a larger extent over the number of years.
We are creating a brand of Bhatia Hospital with the core principles of fair and transparent billing system, respect to patient rights, reasonable charges, dedicated nursing care, looking after patients' relatives as much as the patients, and above all, keeping and nurturing the human bonding in everything what we do.
Hygiene is the unliterated synonym of a hospital. Right from the cafeteria to the visitor areas and to the wards, there is an aroma of cleanliness that underlines the focus. Extensive care is taken in the quality of food served at the cafeteria and to the patients with specific dietary requirements.
The Dietetics Department of Bhatia Hospital has a team of highly committed and dedicated dietitians. Clinical dietitians play a pivotal role in the healthcare system. The role of the clinical dietitian is basically to provide medical nutrition care in various disease state and medical conditions. Along with the IPD patients, we do have educational sessions which are undertaken timely by the dietary department, where we impart the knowledge of nutrition to the groups or to the community. And the overall goal is to advise them the dietary tips, the take-away home message, so that they can have a healthy living. As far as our role in the kitchen is concerned, we do have various other administrative roles like supervising the preparation of the food services, ensuring that right therapeutic regime, the modified diet is served to the patient. At the same time, ensuring that all the food preparation is done under supervised hygienic standards.
Our OPD has some of the most senior doctors the city is privileged with. Talking of modernization, another area that expands beyond the definition of clinical standards is the pediatric ward.
Our pediatric department is one of the finest departments where we have got neonatologists of credit. In addition, we have got technically qualified, specially trained abroad pediatric surgeons who have been dealing with various deformities from birth as well as thereafter the diseases where the children are affected.
Hospitals are the most haunting place for the kids. They don't like being there. Nobody likes being there.
After his treatment, Kaushal is advised rest and observation for a few days. He makes new friends and has his way at the play area, which is one of the highlights of Bhatia Hospital. Moreover, there is special care for special people, the senior citizens who are the life of our community at Bhatia Hospital. Among our doctors, nurses and other departments, we have built special camaraderie. With faith in God and belief in ourselves, we have routine initiatives in conducting welfare camps in distant towns.
We actively encourage patients to assert their rights. We also recognize right to know various charge rates, that is doctor's visit charges, diagnostic charges, bed charges, etc. We respect patients' right to expect no extra charges for portable equipments and for emergency procedures, that is ECG, X-ray, lab test, etc. done on off-duty hours, in the night or on holidays by the hospital. We recognize right of the patient to know the Mediclaim procedure, that is deposits, approval, refund, documentation, etc. We also recognize right to have a fair idea of the total estimated cost of medical treatment updated on regular basis. We respect right of the patient to return the unused medicines at the time of discharge and get credit for the same in the bill.
The hospital helps the underprivileged by providing low cost or virtually free treatment.
Being a hospital registered with the Charity Commissioner, we do 20% of the cases free of charge or indigent and weaker sections.
We have expansion plans where we will have a cardiac unit with the cardiac operation theatre also, with the cath lab and complete setup. And later on in the long run, maybe 5-6 years hence, we will be having a 7-story building which will come up and we will try to give other facilities for the patients.
Smile.